Joining me now is the CEO of the Grattan Institute, John Daley. Mr. Daley, the Prime Minister said this morning there are early signs that we're flattening the curve. Do you agree with his assessment?
So there's no question that the number of new infections per day is not growing as quickly as it was, but it does still appear to be growing materially. And of course, the issue here depends on what your strategy is. If your strategy is to flatten the curve so you don't have quite such a big demand on the hospital system at the peak, but you're essentially trying to let this infection run through the population, then what we're doing probably works. It'll at least reduce some of the demand on the hospital system. And that's what we're seeing, we're seeing an increasing number of infections, but it's not going up quite so fast. If on the other hand, what you're trying to do is actually suppress the infection, as countries like New Zealand and the United Kingdom and Italy and South Korea and China have done, then what you're trying to do is actually see the number of new infections per day less than the day before, and that's not what we're yet seeing.
Well, what do you think is the right strategy? Is it a flatten the curve strategy where, you might have 60% of the population get the virus, but over a longer period of time so that our health system can cope with it? Or do you think an eradication strategy is the better way to go?
So I think an eradication strategy is the better way to go for two reasons. Firstly, and most obviously, far fewer people will die. So if you're going to infect 60% of the population, you can expect a material death rate. And at the peak of the infection, no matter how much you have flattened the curve, you are almost certainly going to overwhelm the hospital system. There are only so many ventilators to go around. Australia is trying to buy more, but so are lots of other countries. And of course, it's not just about ventilators. It's also about intensive care beds and the intensive care nurses that go with them. If you're trying to eradicate it, then obviously far fewer deaths. But here's the point. I would also argue much smaller economic cost in the medium run. Because if you are simply running with this strategy of flattening the curve but letting it go through the population, this is going to run for a very long time.
Is it too late? Is it too late, though, to have an eradication strategy, seeing as we already have such a high number of cases here, and we're only just now, as of tonight, starting to formally quarantine arrivals, international arrivals?
So the quarantine has come in far too late, but it's absolutely one of those things where better late than never, because we are still getting a material number of people coming into the country with the virus, and obviously locking them down so they don't infect anybody else is a good idea. But no, I don't think it's too late. China had substantially more infections than Australia does at this point in the game, and we are going into this having already slowed things down somewhat. So there are fewer infections, if you like, already in the pipe. So no, I don't think it's too late. It's still a very small proportion of the Australian population that is infected. Eradicating it from here is eminently doable, I would have thought. Obviously, though, the faster we get to the point that we've got the country sufficiently locked down that each person is infecting less than one other person, the faster we get to that point, the faster we can get to the point where we have eradicated it, and we can get more economic activity back to perhaps not normal, but certainly something that's a lot more normal than what we've got at the moment.
John Daley, CEO of the Grattan Institute, appreciate your time tonight. Thank you for joining me via Skype.